last night talking about COVID, big address to the nation, talking about July 4th when we'll all be together. Of course, we heard that before under a different president, President Trump, and nothing like that happened for Easter services last year. And where it did, it was a disaster. This year should be something entirely different. We're going to hear the perspective from Dr. Ashish Jha today. He had a briefing this week. I was able to get there. I've got all the goods on where we stand now and where things are going, and I really want to share them with you. But a little personal note first. It has been just a crazy time. You tell me we weren't here last week. I hope you saw my note, sort of vague allusion to OxyContin and the scalpel. I was under the sawbones knife a week and a few days ago here for some surgery. Be good to your joints because you need them all your life, and my knee just busted out in the last little while here. And as soon as the restrictions on surgery were lifted, and because of COVID, many of these so-called elective surgeries weren't allowed. But the doctor called, said, we've got a slot. I zoomed in there, and before you know it, I had a new knee. I was talking with my PT on the other side of that. It has been days of nothing but OxyContin and very painful, oxycodone, I guess it is these days, a very painful physical therapy. My physical therapist was describing what it's like when they replace your knee. She'd been in the surgery room and seen it. I mean, all these joint replacements are terrible, but she said, you know, it looks like you're never, ever going to be put back together again. There's a big incision right down the front of your leg over the knee. They pull the muscles apart. They expose the bones. They saw them both off, top and bottom. So there's just your lower leg dangling there and your upper leg, you know, with nothing really connecting except muscles. And then they go in with the new knee and the spikes that go inside your bone and all the rest, and they sew you up. And that was a week and change ago. And today I was out walking up the street to get coffee. It is a miracle, but it's not a pain-free miracle. I have been chewing down the painkillers. Just stopped on those a day and a half ago. So I don't think I'm still running Oxy here. I don't think that's what I'm running on. But the pain is real. And I'm so glad to have it done. And I'm so grateful to be on the other side of that. And sorry I missed you last week, but that's what was going on. It was very dramatic. You know, I did a lot of sports when I was young, and things take their toll, and over time they mount up. And so there we are. But now we've got it done, and we're looking at a whole new time for the country on COVID. Lots of people watched Joe Biden last night. You know, you watch him, and at first we've been so conditioned for that high accelerant kind of get all your nerves jangled thing with presidential speeches over the last few years that you're thinking, wow, has this really got the stuff? And then you listen and you say, gosh, this does have the stuff. He's saying what we need to hear about a really terrible pandemic. This week, I thought maybe there's no way I can do it again. I'm in such a fog of pain. But yesterday, on the anniversary of COVID-19 being declared a global pandemic, there was a terrific press briefing by Dr. Ashish Jha. He is now the dean of the Brown University School of Public Health. He was director of the Harvard Global Health Institute until just last fall. You may have seen him. He's all over the media, plugged in everywhere. I mean, globally, testifying to Congress. This guy is just one of the great information nodes in this country about COVID-19. We've had great conversations about COVID-19 right here, and many of you have been with me for those, with Naheed Badilia, the great doctor right here in Boston, who's done so much work on Ebola in Africa and now the pandemic here, with the great Margaret Bordeaux, who told us just a few weeks ago that we had to watch out because the new variants could mean that COVID could still win if we weren't careful. And it was great to have her with us. She was not wrong, and I'll tell you exactly what Ashish Jha has to say about that. It's really interesting where we stand on that. So a press briefing these days, what is it? A press briefing very commonly is online, and that's what this was. Yours truly lying in his fog of pain, but taking it all on board to dutifully bring it to you because it's really interesting detail, and I want to share it with you. And this from, again, Ashish Jha, who's right in the middle of all this. I can't wait till we actually have him on. But this week, I thought, let's go get the information and let's bring it. We're at 1 year out, and what a year it's been. I'll talk a little bit about that at the end of our conversation here today. So here we are. Big takeaway from Ashish Jha, and we should have known this, we did know this, but we've been living in a kind of bubble of anti-science, know-nothingism, and also, just the human nature doesn't want to think about disease and things that knock us off of our stride. Ashish Jha says this is not the last global pandemic that we're going to face, but we can face future pandemics in a much, much more effective way than we have. He said we just cannot afford to repeat the way we address this one. Look how costly it's been to us, to families, to businesses, to social cohesion. I mean, this has been a major, major lifetime event, and I think many people will remember it that way. It didn't need to be this way. It cannot be this way again in the future. He says, we can't repeat this going forward, and we don't have to. He said, it's tempting to think right now, when the news of all the vaccines that are rushing out, Joe Biden saying by May 1st, every American should be able to go out and work on getting their vaccine. By May 1st, that is not far away. It's tempting to think that it's okay, it's over, it's time to open up. No. The big takeaway from Ashish Jha is that we have, and I welcome your questions here. I can't answer them as a doctor, but I can answer them off of the in-depth briefing that Jha shared with us, and I'm happy to do that. If you're on Facebook, just bang your questions or your comments in here, and I'm happy to have them, very happy to have them. He says, this is not the moment to open up. Here's why. Despite all the good news, and there's amazing news, what we've seen on the vaccine front is incredible. Just getting the vaccines that were so effective here. And we've got more coming on stream right now, a fourth Novavax coming out just today, which is looking very effective. That's a fourth vaccine. And this only a year out from when this was officially declared a global pandemic. It's just amazing. And the volume of those vaccines now coming on stream. But the message from Ashish Jha, there is still, right now, as we sit here today, there is still a very high rate of infection in this country. I mean, we're through the very worst of it, which was January, very early February, but we still have 50 or 60,000 new infections recorded every day. That's been leveling off some days look like it's plateauing. We hope it is, but that's still a high rate of new infections out there. So we're not away from the time when this is out there, it's among us, and it's still infecting people, and people are still dying. And he was very clear on saying, this is not the time you want to catch COVID and die. It's like being that proverbial last soldier to die in a war. We're so close here to a much better situation. This is the time to be careful. And when you look out now and survey what's going on in some of the states around the country, like Texas and others, where they're saying, hey, everybody open up, let's go. No, the message is no. Second reason, variants. Viruses morph and change, and they are doing that, as we all know. We've heard all about this. In particular, the B117 variant, this is out of the UK, is making huge inroads in the United States. Jha saying that, and this is important because it's more contagious and it's more lethal than the widespread form of COVID that we've all been dealing with and we've been specifically vaccinated for. 40 to 70% more contagious, 40 to 70% more lethal. And it's already now 20 to 30% of US infections. And Ashish Jha saying sometime later this year, it won't be long, probably before April, that's like this month, B117 will be the dominant strain of COVID-19 in this country. Take that on board. So right in front of us, and it's happening day by day, this variant, which we've called variant, but it's about to be called the dominant strain here, that's 40 to 70% more contagious and 40% more lethal, will be the dominant strain in this country by next month, by the end of this month. That means be careful right now, because there's good news. There's lots of good news here too, but you don't want to be the one who catches it, it's more contagious, or comes down with it, it's more deadly. But watch out right now. It's going to dominate soon. There could be, for all the good news, Ashish Jha is saying if we can make it through the next 4 to 6 weeks, just 4 to 6 weeks, without blowing it here, we're going to be on a very good path. But there are others in his field who see another enormous spike coming before we're really into the fullness of spring even. I mean, right in front of us. If people start dropping their masks and start dropping social distancing and getting into close proximity and opening up businesses, we could have another deadly, massive spike before Well, in no time at all, in just a matter of weeks. That would be a gigantic tragedy. Because as he points out, as he sees it, we're 4 to 6 weeks away, if we play our cards right, of being in a very, very different position on COVID-19. So this is not the time to be opening up restaurants. He thinks we'll stave off the worst. He doesn't think this will happen, but it could, and he acknowledges that he has colleagues in the field who think that we could still face another giant upsurge in COVID-19 with everything that comes with that on our medical system, on our educational system, on our families, on our lives. Third reason to be really still careful right now is that for all of the efforts on vaccination, and it's amazing the rate at which they're rolling out right now, most high-risk people are still not vaccinated. And we're not talking here just about older people, the elderly, but people who have medical conditions who make them particularly vulnerable to COVID-19. Most of them at this point are still not vaccinated, but the vaccine is rolling out at a huge and expanding pace now, more and more rapid pace. So there it is. 4 to 6 weeks, if we hold it together, if we keep the lid on this thing, if we let the vaccine roll across the country, we will be in a very good place, says Ashish Jha, to face the spring, the summer, this fall, and the future that comes at us. 4 to 6 weeks, but getting past that period safely is absolutely essential, quoting him there, and we've just got to do it. So if you've got leaders, people, institutions in your community who are pretending that this is over, let the good times roll, or that heard the president last night say, we'll have our picnics on the 4th of July and think that that's a guaranteed thing, the word from this top global health, public health expert in the world, no, it's not guaranteed unless we get past the time right in front of us. By late April, on the vaccine front, he's saying, after all these weeks and months where it's been a struggle to find and get and sign up for and get that vaccine in your arm. I got mine a couple of weeks ago. I got the next one coming in a week, and I'm so excited about that. But it's been tough. It's been tough to nail down. I got lucky. So by late April, supply will be ahead of demand for vaccine. More supply than demand, flipping the circumstance that we've been in for all these last weeks. Now think about that. That raises some very different dynamics, and we'll talk about that. There should be demand because there's millions and millions of unvaccinated people, and also whether and when the United States needs to begin pushing vaccine out to the rest of the world. That's a key question, because of course we don't live in isolation here, and if the if the virus continues to rage in the rest of the world and continue to spin out new variants, maybe more deadly variants, we could all be back in the soup. So both of those questions are big. We'll come to them. Supply may outstrip demand by late April. That's pretty amazing. CDC, very recently saying you can start to travel a little bit. You can start to be with people. Ashish Jha's got his own view on that, saying that, first of all, how much does the vaccine cut down on transmission? Do people who have been vaccinated still transmit the virus? Well, yes. How much do they transmit it? We don't know exactly. His guess is that the vaccine cuts down transmission by 80 to 90%. You're vaccinated, 80 to 90% less likely to transmit COVID if you somehow, got it, you're carrying it, but it's not affecting you because you're vaccinated. That's a 10 to 20% chance of passing it on, but it could be higher than that. But that's not the only issue. Of course, it's all the other things about social distancing and masking and using common sense until we get around this corner. Schools. So if you've got the right things going on, the time for opening there, very close. If you're masking, if you're ventilating, if you're testing, we'll talk about testing too, because testing is going to become a part of our lives in a way it really never quite did, even in the heat of the virus. But we've got to get back to some kind of normalcy for the kids in schools, and that's certainly possible if people are taking those steps. Now, threats, most obvious one, new variants. They could still come up, and that's absolutely a risk. At best, it may take us 3 or 4 more years to see widespread global immunization, vaccination. during that time, we're still going to be vulnerable and there's still going to be issues. We need to help the rest of the world get vaccinated for their sakes, for their lives, and for our own. But we're turning a corner if we don't get sloppy, if we don't get careless, and if we keep the vaccine rollout going. Ashish Jha saying we're turning a corner. The future looks much, much better. Plenty of work to be done in the short term and the longer term. But that's his big takeaway here. That is a pretty exciting analysis of where we stand in COVID-19 this early in 2020. And it's great to share it with you. I want to share some of his other takes on what's going on. We've got the vaccine. We have it in ever larger supply. People are going to be getting it just hand over fist here, but the willingness and readiness to get it is not uniformly spread across the population. He said his big worry is among conservative, white Republicans. There's a lot of talk about some minority populations, African-American populations, and their readiness to get the vaccine. But Ashish Jha is saying overall, the issue there is access, not willingness. There's issues of trust and access, but the readiness to do it. There are new polls out this week showing that you've got white conservatives in this country at 40% plus expressing resistance to the vaccine. This is a big deal because he says if we get stuck, if we ramp up this vaccination, make tons of vaccine available, vaccinate millions and millions of people, we're raising our sort of herd immunity higher and higher. But if we get stuck at a point where only 60, 65% of the country has been vaccinated, we're going to have real problems. That's not enough. And you and I and all of us will not be able to enjoy that kind of exhale and really live again life that we're all waiting for. Jha saying that we're going to need, as this right now it's all been about scarcity and finding the vaccine, but as it rolls out and it's everywhere, then it becomes who's going out to get it, who's stepping up, rolling up their sleeve to get it in their arm. And if they're not doing that, we're in trouble. He said we need figures like back in the 50s when the polio vaccine came out. And there was, there's always some hesitancy, some trepidation when new medicines, new vaccines come on. Elvis Presley stepped up and in a very public way, rolled up his sleeve and very, very publicly and famously got the polio vaccine. And it just sent off a torrent of others doing the same. And popular opinion really turned toward the vaccine. Listening to him, I'm thinking in the back of my mind, okay, it's one thing to be sort of resistant and badass toward the vaccine when there's not much out there and when things seem pretty terrible anyway. But I have a feeling that pretty soon, all kinds of people, no matter what your walk of life, are going to start feeling isolated and vulnerable if they don't have the vaccine. Let's pray to God we don't get stuck on some hard, know-nothing, unpersuadable nut of Americans who won't do it. That's of any substantial size. That will hurt all of us. I hope we don't. We need people, not just the 4 presidents, all the former presidents except Donald Trump, who came out with their ad this week praising the vaccine and getting it and talking about encouraging everyone to get it. But we need more public figures doing that in many communities, and I hope we see that soon. Testing is going to become a big deal. So picture this. Let's say there's vaccine everywhere. People are getting it like crazy. Confidence is rising. More and more people are coming in. We don't get stuck at 60 or 65%, but we go right up to 70, 80, 90% vaccinated. Now, there's still going to be COVID-19 out there, and you're still not going to want to get it. And yet, people want to do things. They've been waiting a long time, and we've been vaccinated, and that's pretty good coverage right there. Testing is going to become something that we run into in a new and different way. He's looking forward to COVID-19 tests of just cost $3 or $4 a pop, and that people do at big gatherings. Let's say you go to a big indoor concert. You may go into an area where you're tested before you're admitted. What I took away from him was summer camps. You want to send your kid off to camp? They may be tested when they arrive, if not before, but right there. And all kinds of big public gatherings may begin to do a lot of testing. And so this is the antigen rapid turnaround. You learn in a matter of minutes whether you're showing signs of COVID-19 or not. That is likely to become part of our lives by summer, late summer. You want to go to that big arena concert? Okay, but you may be tested before you go through the door. Travel. Okay. His view on travel. Everybody wants to do it. People have put off travel. They haven't seen family. They haven't seen friends. They haven't taken a vacation. They haven't been anywhere. Everyone's going stir crazy. Yeah. He said, if you've been vaccinated, he doesn't think it's unsafe to travel. Jump on a plane and fly long flight around the world to Hong Kong, Australia? No. But right now, shorter haul within the US, if you've been vaccinated and you're taking all the reasonable precautions, and the airlines are too, okay, we're coming up on that. Now, by the summertime, he says, absolutely people should assume travel will be relatively safe over the summer. Well, relatively is still a word in there, but that's a better description of where we are than we've been in a long time. People want to travel. There was talk in this press briefing about a Bank of America survey of credit card activity, and that showed lots of people making bookings for the summer, lots of people in their 70s and 80s. Of course, your credit card companies know everything about you, so they know how old you are. That's grandparents want to go see their grandchildren, and he's saying that's probably going to be fine, as long as, again, we make it through this next 4 to 6 weeks without screwing this up. Over the summer, he's expecting that the infection rate, because of course summer is better in general, the infection rate is likely to be very, very low. The pandemic then moving into really a new phase. It won't dominate our lives. On the other hand, Ashish Jha saying, it won't be gone. Don't fool yourself. This thing's not disappearing. It's not out of our lives. It will become endemic. It will be with us for years, but not in the way, and this is what we have to get our heads around. Something calamitous happened in this last year. We know it, but once it's happened, you kind of accept that maybe, well, that's just the way it had to be. It doesn't. It didn't. That's not how pandemics are supposed to be handled. That's not, pray to God, how we handle them in the future. We will handle them better if we keep our wits about ourselves, but it's going to be around and we're going to have to deal with it. But it doesn't mean that life has to be this hunkered down, in the bunkered, isolated kind of nightmare that it's been in this last year. We're going to need more therapies because there will be a remaining risk of getting COVID-19. It's not going to go away entirely. So for those who are unlucky to get it, unlucky enough to get it, we don't want to write them off. And new and better therapies, there aren't many options today, but we're going to need a lot of work on that. Oral therapies, easy therapies, so that if you're unlucky enough, once we get on top of this thing, you can be treated. And it's not a death sentence, or you won't have to worry that, oh my God, here I go, ventilator, goodbye family, locked behind the glass, and all the nightmare we've seen is well over 500,000 Americans alone have died in the last year. Now, the vaccine itself, and how long does it last, and what happens as the variants come in and take more of a position? Well, on the B.1.1.7, which he thinks will be dominant by next month, and this is the more contagious and more lethal UK origin variant, he says the Moderna and Pfizer, our current vaccines, are pretty good on that. So you shouldn't need a booster on those to deal with B.1.1.7. So the issue there, 117, the issue there is not for those who have been vaccinated so much. It's for those in this window ahead of us who haven't been vaccinated yet and are more vulnerable to getting it and dying from it. But once they're vaccinated, even when it's dominant, he's saying, they'll have pretty good immunity to it. Now, we still don't know about some of these other variants. The South African variant, the Brazilian variant, we don't know how the vaccines work on those. We also don't know if we don't get more vaccine pushed abroad, and if we don't get ourselves quickly, massively vaccinated here at home, then it sets up what would be a battle between the B.1.17 variant and these South African and Brazilian variants for dominance, even here in the US potentially. If the other variants win out, we're less sure about those and the vaccines that we have now. We could be in a whole world of trouble again there, but he doesn't think that will happen. But if we screw up, we give things an opportunity, things can happen. If the others come back, you might see outbreaks in different directions than we've seen. The elderly were most vulnerable to the COVID strain that we've been battling with for the last year. But if one of these new variants, if we give it a chance to come in and take hold, it could be different. It could be harder on young people. Lots of unknowns there. So a lot to be done on that. His best guess is that on transmission, the variants, the vaccines cutting transmission, he's thinking that the vaccines are pretty good on cutting transmission, but we got to stay on top of it so these variants don't get up and ahead of things. Cheryl Gay Stolberg was at the press conference from the New York Times and was asking, when ought the United States start sharing more vaccine on a wider basis with the rest of the world? You can see we got really critical questions answered. It was a great briefing, just great. Joe Biden saying in the last couple days, not until Americans have it. Okay, but there may be circumstances in which we have kinds of vaccines that could go abroad even sooner. Biden saying he won't do it until Americans all have the vaccine. Great, okay. But also at the same time, by May, any American who wants to have it can have it, and we're going to have supply running ahead of demand. So could be that just in the next couple of months, we could start pushing more toward the rest of the world. His thought, Ashish's thought, was that before every 18 and 20-year-old here in the US is vaccinated, we might very reasonably want to be shipping it out elsewhere around the world, in particular to healthcare workers in poorer countries where they carry a much greater burden of patients per head to care for, where they are extremely vulnerable right now, where COVID's still growing, and where that whole population of professional healthcare workers that take care of the local people, save their lives, take care of their lives, and by that, make themselves part of a worldwide network of healthcare workers that keep all of us safe from this virus and others that may arise. He said it's possible if we don't get vaccine out to those workers, at least and quickly, we could lose a generation of healthcare workers around the world that would leave their local populations and all of us much more vulnerable for a long time. So first target for available vaccine from the United States, he's saying get it to health workers around the world. What could be more reasonable than that? And then just as much as we can and as fast as we can out the door. How long are these vaccines going to last? Well, his guess is that more than 1 year and probably multiple years. How much more? We don't know. At some point, you get waning immunity. Will we need boosters? We may or we may not. They're going to have to keep sequencing the different variants that are in play, seeing how they go. It may be that older people need booster shots sooner than others. So when we do it, we should probably do it by risk group, as we did initially with the vaccine here. His sense is that some people getting the vaccine now may need a booster next year. Moderna and Pfizer and others already working on this. Of course, it all depends how all of these things morph, and that depends on us continuing to work very steadily to be on top of it, so there's not much chance for the disease to get away from us and change in a way that becomes more lethal, where the vaccines lose their effectiveness, and we're really in the pickle again. Vaccine passports. You may have heard people start to talk about this. I think we're going to hear a lot more about this, and he was saying the same here. Israel already seeing these come out. That is, you're carrying a kind of certification that you've been vaccinated, and more, we may see transportation carriers, venues asking for this when you show up. Sure, we welcome your business if you've been vaccinated. Let's say, already airlines are looking at this, Jha said, especially for long haul flights. You want to fly to Australia or Hong Kong. They'll want proof of immunization before you do that. He said he could also imagine events that would let you know in advance you know, here's a big concert, here's a big conference, here's an event, but you're going to have to come with authenticated certification that you are fully vaccinated to gain admission. So that kind of vaccine passport use is likely to become widespread, likely, he said, to be driven by the private sector, because they're going to want to permit their patrons to patronize their business with a sense of confidence. So you see what I mean about how once a lot of people are vaccinated, I think even those who have been resistant are probably going to turn around, because it's one thing to say, hey, I don't want to be vaccinated, but it's another thing to say, well, I sure would like to fly to see my family in California or South Carolina, but I don't have a passport to get on the plane. People are probably more likely to go out and get it. I hope so. Jha overall saying we should be optimistic about where we are as a country, and that this is going to be a much better summer, fall, and year ahead. This is kind of an amazing year. It's been a horrible year. The virus will be around, it will be back. But his big point was that we now have reasserted our knowledge and understanding and actual ownership of the tools to address a virus like this. It doesn't need to become pandemic. This didn't need to, and it doesn't need to. It shouldn't flatten us. It shouldn't flatten us in the future like it did in this last year. So there's the readout of the briefing from Dr. Ashish Jha. He's Dean of the Brown University School of Public Health. Just a terrific, terrific guy. I found all that to be really useful information. Made me think back on this last year, and what a wild time it's been. Sad in many dimensions. I don't know about you, but I have had deaths in the family. I have attended funerals on Zoom. My own father died last summer, and I was unable to be with him at that time. That was hard. Hard to tell the family. We didn't think we should come home for a funeral. We should put it off until this was past. But of course, everybody got in their cars and went anyway. It was summer, infection rates were relatively low. People masked, people socially distanced. Nobody caught COVID out of it. And we carried his casket up the hill and buried him, you know, sitting those 6 feet apart. But that was sad. And for many families, even that wasn't possible. Watching other loved ones, you know, catch COVID in the hospital and come home and die from it. Just devastating families and taking loved ones away from people who need them. My own grandchildren lost one of their grandmothers in this last year, and it's really tragic. And she and many, 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 hundreds of thousands of others will be really missed. At the same time, we've seen a different kind of moments of family. Like, we've been at home, we've been with each other. There have been times when my little pod here we've looked at each other, all of us, and said, you know, it's crazy all working out of the study, and we're kind of piled on top of each other, but there's an intimacy that's come with this, which, if your circumstances were right, were a blessing. And I have to say that it's been that in some ways right here at the Ashbrook house. My more far-flung kids, I miss a lot, and I cannot wait to see them. You must feel the same about your kids and parents and aunts and uncles and all the rest. But if Ashish Jha is right, and if we make it through this next 4 to 6 weeks, keep that mask on, keep your social distance, don't go nuts at the restaurant and bar. Good times are coming. You don't want to be the last one to die from this. You don't want to give it to someone else and make them the last one to die from this. We're talking about much better times ahead. And if we stay level-headed and common sense about this, focused on the science, and never again dismissive and untruthful about the health challenges that may face us, we can have a much better future, even with COVID in the world. So that's the readout on the briefing from the great Dr. Ashish Jha, and a little personal contemplation on this last year as well. I'm with Joe Biden when he says, let's do this, let's do it together. Let's make that the American way, not fighting over it, but solving it, so we can have good lives and good lives together. I wish good health to all of you. Keep that mask on for a little while longer, social distance for a little while longer, And I'd be happy to see a whole lot of people at that July 4th picnic. Let's hope we get there. The danger's not gone. But the vision of what we can have, the reality of what we can have is right in front of us now. And let's grab it. Thanks a lot for joining us today. We'll talk to you next week. And no more oxy from me. I think I'm past it now. But who knows, after sitting here for 15 minutes, I may have to go scream and do painful jumping jacks. Thanks a lot for being here. See you soon.